Hello, my name is Helen Perryman. I graduated from the Royal Veterinary College in 2009 and set up Positive Vet Care in 2018, providing home visits for veterinary treatment around Coventry and Warwickshire. Over the last few days, I have had lots of questions about puppy vaccinations during the current Covid-19 restrictions. I realise that this is a very worrying time for you if you have or are getting a new puppy that hasn't had their full vaccinations. This presentation should hopefully explain what the current situation is and how you can go about protecting your puppy as much as possible until they can receive their vaccines. I will do a later presentation about how you can socialise your puppy while you can't take them out as normal. If you have any further questions, please feel free to contact me. My contact details will be on the last slide. And please note that this is an evolving situation and these recommendations are valid as they are recorded on the 30th of March 2020. So firstly, what is the current situation and why are we not able to vaccinate your puppy at the moment? Well, on the 23rd of March, the government called on the whole UK population to stay at home for an initial period of 3 weeks. Staying at home will reduce the rate of transmission of coronavirus, leading to fewer cases, which will therefore be less likely to overwhelm the capacity of the NHS to care for the very sick. This will save lives. We all have a part to play in this. Every encounter we have with another person, predominantly directly, but also indirectly to some extent, has the potential outcome of increasing the spread of disease and leading to the death of someone. So what does this mean for vets? Well, we have a responsibility to safeguard animal health and welfare, but we also have a role in protecting public health, and at the moment, this has to take precedence. The government have allowed vets to remain available for urgent and emergency cases, but this does not include vaccinations, apart from in the face of an actual disease outbreak. So why do puppy vaccinations not count as urgent? Well, because there are things that can be done to reduce the risk of puppies picking up these diseases that we vaccinate against. So at least in the short term, vaccinating our puppies cannot be considered more important than saving human lives. If the situation lasts longer than the initial 3 weeks, this advice may be revised. So what can we do in the meantime to protect our puppies? Well, it might be useful to look at what diseases we vaccinate against first to find out more about them. Parvovirus is the main disease that is talked about. It is the most frequently seen of all the diseases in the core puppy vaccinations, and it is often fatal. It causes very severe vomiting and diarrhoea, leading to severe dehydration. It is very infectious and can survive in the environment for months. Older dogs with parvovirus may not show many signs, but puppies aged between 6 weeks and 6 months are often very severely affected. Parvovirus can be picked up anywhere where another dog has been, such as the street or a park, or it can be carried into the house by humans on their shoes or clothing if they have been to a contaminated area. So how can you protect your puppy from this horrible disease? Firstly, don't allow them to walk on the ground anywhere that an unvaccinated dog might have been. This includes the pavement and parks. Your garden should be safe as long as it is enclosed and does not have a high population of foxes. Carrying your puppy around the street or using a pushchair or similar is fine and actually to be encouraged for socialisation purposes, but make sure no unvaccinated comes up to them and has any physical contact. Keep outdoor shoes well away from your puppy, or disinfect them before you come into your house, and wash your hands thoroughly before touching your puppy. This will all reduce the risk of bringing virus particles from outside the home into your home and in contact with your puppy. If you have been sitting on the ground outside or have had any contact with other dogs who may not be fully vaccinated, you should change and wash your clothes as well. Distemper is another disease that we vaccinate all puppies against. This is a very rare disease nowadays, but there are still occasional outbreaks. Distemper causes a lot of different clinical signs, such as fever, runny eyes and nose, coughing, diarrhea, loss of appetite, thickened paw pads and nose, and neurological signs including seizures. It is often fatal and can cause lifelong problems in dogs that do survive. As with parvovirus, puppies under 6 months old are particularly susceptible to distemper. It does not last for as long in the environment as parvovirus, and the precautions that we mentioned for parvovirus will also reduce the risk of your puppy picking up distemper. Infectious hepatitis is the third of the 3 worldwide core diseases that the World Small Animal Veterinary Association recommend that all dogs are vaccinated against. While this can be fatal, animals usually recover from this illness, although they may have lifelong problems because of it. It can survive in the environment for months, and dogs that have recovered can still shed the virus for up to a year. It causes fever, loss of appetite, coughing, bluing of the eyes, and signs of liver disease such as jaundice. Precautions to protect against parvovirus and distemper should also protect your puppy against infectious hepatitis. Leptospirosis is considered a core vaccination in the UK. This is a zoonotic disease, which means it can also affect people. It is usually known as Weil's disease in people and is caused by leptospira bacteria rather than a virus. Leptospirosis is most commonly transmitted through the urine of rodents. It can cause a variety of different problems, the most dangerous of which are acute kidney failure and liver failure. To reduce the risk of your puppy picking up leptospirosis, keep them away from areas of slow-moving or stagnant water and any areas with a high rat or mouse population. Stable yards and farms can be particularly dangerous sources of leptospirosis. Kennel cough is not considered to be a core vaccination, but it is the most common of all the infectious diseases that we see in dogs which can be vaccinated against. Kennel cough is made up of lots of different viruses and bacteria, similar to our common cold. Vaccination is only available against 2 of these, in addition to the core virus vaccines. These are the parainfluenza virus and Bordetella bacteria. Unlike the name suggests, your dog does not have to have been in kennels to become infected. It just spreads extremely rapidly in a kennel environment. Kennel cough is usually transmitted through the air or contaminated surfaces where a dog has coughed or sneezed. Kennel cough normally resolves on its own, but young puppies are more susceptible to it developing into pneumonia. By keeping your puppy away from other dogs, you will be protecting them from kennel cough as much as is possible. So, having looked at these different diseases, what is the take-home message for protecting your puppy? Firstly, do not allow them to walk on the ground outside unless it is in a secure garden with a low rodent and fox population. Secondly, practice good hygiene around your puppy, washing your hands before handling them and disinfecting shoes and clothing that have been in contact with the ground outside or with other dogs. Thirdly, Practice social distancing between your puppy and dogs outside of your household, just as you are doing with other people who are not part of your household at the moment. So what happens when your puppy can have their vaccinations? Now at the moment we don't know when this will be. The guidance is being reviewed every 3 weeks, so hopefully we will be able to start your puppy's vaccinations soon. Different vaccine manufacturers have different recommendations, but with the ones we use at Positive Vet Care, the distemper, hepatitis and parvovirus component, DHP, is licensed for a single dose once your puppy is over 10 weeks of age. Although in accordance with the WSAVA guidelines, we do recommend a final dose at least 16 weeks of age. This vaccine provides immunity after 1 week. The leptospirosis component needs 2 vaccinations 4 weeks apart and takes 3 weeks to provide full immunity. So if your puppy is under 10 weeks of age, they will need an initial full vaccination with a second full vaccination 4 weeks later. They can start going outside and mixing with other dogs a week after the second vaccination, but they should be kept away from slow-moving or stagnant water or areas with a high rodent population for a further 2 weeks. If your puppy is over 10 weeks old, they will need an initial full vaccination, can start going outside and mixing with other dogs after 1 week, and have their second leptospirosis vaccine, possibly combined with the DHP components as well, 4 weeks after the first. They should be kept away from slow-moving or stagnant water or areas with a high rodent population for a further 3 weeks. If your puppy is over 16 weeks of age, they will need an initial vaccination and can start going outside and mixing with other dogs after 1 week, and then have their second leptospirosis vaccination 4 weeks after the first. Again, they should be kept away from slow-moving or stagnant water or areas with a high rodent population for a further 3 weeks. The kennel cough vaccine can be given at any time and is just a single dose. And what about socialisation? Well, in puppies, the window for socialisation and habituation, that is getting them used to all the things they need to know about and not be scared of, is open between 3 weeks and about 16 weeks of age, although this is an average and can vary from between 8 weeks to 20 weeks. During this time, it is really important to expose your puppy to as many different positive experiences as possible. Obviously, this is going to be more difficult in a period of social distancing, and even more so if you are trying to protect your puppy against these diseases as well. I will do a further presentation about things you can do to help with this, so please check back over the next few days for this information. If you would like to contact me for further information, please email me at admin@positivevetcare.co.uk. You can also visit the website www.positivevetcare.co.uk. You can follow us on Facebook, Instagram, Twitter and LinkedIn with the social media handle @VetPositive. If you would like to arrange a video consultation for just £15, please book via our website and sign up to Pets app, which is available on Android and iOS. Just select Positive Vet Care as your practice. We look forward to hearing from you soon and wish you all the best with your new puppy.